On this episode of RPA, every day 100 Australians suffer a stroke.
Touch your nose.
It's Kylie and her team's job to stop them from dying.
You do look like you are having a stroke.
Single mum Tracy's biggest fear.
They lost their dad when they were 6 and 2, and I'm all they've got.
Her brain tumour is back.
It may now have transformed into something more aggressive.
But her courage never left.
I don't want them to be orphans.
And double trouble for Hazel and Frank.
I'm going to touch your right wrist now. Can you tell me if that hurts?
Yes.
After a serious crash,
What about the car?
It's right off.
lands them both in ED.
I'm concerned that you have a sternal fracture.
Motorbikes have always been a passion for 45-year-old single mum Tracy.
I've always wanted to ride, and as a teenager, I did the paper delivery to save money to buy a motorbike. The motorbikes have taken me along lots of journeys.
It's precious family time she shares with her 2 teenage kids, Trez and Wiley. It's also how she discovered her life was about to change.
I was actually on a charity ride on this bike that I first had an episode which turned out to be a seizure. I'd lost peripheral vision, but I didn't realise that at the time. I no sooner got help to get off the bike, and then I felt okay. Like I could see properly again, and I thought, that's a little bit weird. It was scary, and I knew that I needed to just go and follow it up and get a check and see. And that's how I found out that I had the brain cancer. So I don't ride as much anymore. I still love to ride, I just don't go as far anymore.
After major surgery in 2018 to remove a glioma, or brain tumour, life started to return to normal for this local postie.
4 years later, my last scan showed regrowth. So we're back on the same journey, I guess, again. There is no cure, and I've got 2 small children, so I need to make sure that we make all the right decisions now, that in hopefully years to come, I'm still going to be around and I can still watch them grow and do all the things that parents are meant to do. Oh, did you see that? You want to see the kids get their first job. You want to teach them to drive. You want to do the whole wedding thing and children, and there's so much that runs through your mind and all the things that you think that you're going to miss out on and what they're going to miss out on too.
With those thoughts consuming her, Tracy is desperate to understand just how aggressive her new cancer is.
You know, they lost their dad when they were 6 and 2, and I'm all they've got. I don't want them to be orphans. They don't deserve that. So I need to do everything I can, not only to fit as much in, but make sure I make the right decisions and get the best care and hopefully preserve as many years as we can. And I feel that it's our only hope. It's the only way that I can be confident that I'm going to be here for the kids.
On any given day or night, nurse consultant Kylie Tastula is always on standby. From her office at RPA, she coordinates the emergency response for anyone experiencing a life-threatening stroke across the entire state of New South Wales.
Stroke is a devastating illness, so it impacts about 1 in 6 people in their lifetime in Australia. There's about 50,000 strokes that occur every year.
Strokes are caused by a disruption of blood flow to the brain from either a clot in an artery or a bleed.
It is something that all of a sudden happens, a stroke, and it causes tissue damage, and which will lead to death of brain cells, which is what then leads to the damage. The earlier someone gets to hospital, the more likely we are to be able to treat them and the better the outcomes are for that patient.
At a moment's notice, Kylie can call a specialised stroke team to action.
5 years ago, these patients may have ended up in nursing homes. They were having big strokes that they weren't able to move their arm, they weren't able to walk, they weren't able to talk, and they ended up with terrible disabilities as a result. We now have certain types of treatments that we can offer. IV thrombolysis is one of the clot-busting drugs that we can give. The sooner we give that, the better the outcomes are for our patients.
With strokes affecting 1 in 6 people in their lifetime, Kylie has her hands full.
So we've just been notified that there's a 62-year-old man who's coming in, who's got a right-sided weakness and some problems with his speech, so potentially signs of a stroke. Bruce, my name is Kylie and this is Alex. We work in the stroke team. We just want to quickly do an assessment, is that okay?
Yeah, of course it is.
With one of your fingers, can you touch my finger? Yep, touch your nose.
Widow and single mum Tracy has come to RPA with her 2 teenagers, Trez and Wiley. They're meeting with neurosurgeon Dr. Brinda Shivalingam about the recurrence of Tracy's brain tumour.
And tell me a little bit more about your life, Tracy. What sort of work do you do?
Oh, I do the local mail.
Okay.
So on a postie.
You're a postie. Yeah,
Yep.
great. I went into medicine originally thinking that I would focus on research because I had this incredible fascination with the brain, probably from the time I was a young child, actually. I was very much drawn to patients with brain tumours because it's probably the worst thing imaginable.
I was told that it would return. There was just no way of knowing how long it would actually take.
Certainly the current scan shows a definite regrowth of tumour, and that's why we're here.
Yeah.
It's a big impact to them and their families, and a great deal of suffering that comes from this diagnosis of a brain tumour. Given the recurrence and given the way it's recurring, I do think we need to move towards an operation again.
Mm-hmm.
This concept of surgery to remove this tumour and what that might do to you as a person, that's very frightening. You know, someone having to go in there and take out a part of your brain, including a tumour, and that might leave some problems that you will have to live with for the rest of your life. When we look at your scan, what I'm seeing is that there's an area that looks like a lump.
Mm-hmm.
And separate to that lump, or coming out of that lump, there seems to be some hazy sort of tentacles that infiltrate your brain. And therefore, if I try to chase that, we would have to take out a lot of brain, and that would cause you a lot of problems. So what I'm going to focus on is removing the lump part of it, because those wispy areas, we haven't changed at all. So it's only really this part, the top part of it, that has changed.
Mm-hmm. Okay.
Okay.
All right.
So you guys are going to have to look after her a bit after.
Yeah.
I mean, she'll be fine, but she just needs to be pampered. Yeah?
Yeah.
You can do that? Yeah. Empathy is the key. You know, you don't have to own that person's problem, but you do have to deliver it in a compassionate way. Clearly, clear, concise language so that they do understand what's going on.
We do need some hope.
Yeah, it's a rough journey. Yeah.
It's just hard with these guys, I guess.
Yeah.
I'm usually pretty good on my own.
They seem pretty strong, don't you?
Yeah, they've been good.
Yeah. We do have to give bad news a lot, which is not at all fun, not at all a good part of our job. And it's something that I've found harder as I've gotten older, actually. I feel it more. I really have to sit back for a while afterwards to get myself together before I can move on again.
Frank and his partner Hazel have just been rushed to a bustling emergency department after crashing their new car.
So what happened exactly?
I was going down the driveway into the garage and there was a car in front and I had my foot on the brake waiting for them to use the swiper to get in. And my foot just slipped onto the accelerator and the car just surged. And then I just had to turn the wheel and try not to hit the people in front. Slammed into the door and the concrete pylon.
While Frank is assessed exactly where he sat down, Hazel is taken straight to a resus bay.
Oh, that's it. That was
beautiful. I feel really bad. She's hurt much more than me.
Biggest concerns with a motor vehicle accident is internal bleeding. So obviously there can be the force of the impact can cause a lot of injuries that we can't actually physically see, which is why the first period of time once they hit us in the ED department is so crucial.
And what happened to you when the car smashed into the pole?
Oh, I put my hands up and there was just happened so quickly.
Yeah.
And the bag opened and yeah.
So you put your hands out to stop, and then the airbags went off.
Yes.
I'm going to touch your right wrist now. Can you tell me if that hurts?
Yes.
That hurts to press?
Yes, that's painful.
That's very painful there.
I'm concerned that you have a sternal fracture, which sometimes isn't very easy to pick up on a chest x-ray, so we might need to do a scan as well. And because there's some question about you hitting your head and loss of consciousness, we'll probably do a scan of your brain and your chest.
After that happened, how did you get out of the car? What happened after
well,
that?
people were there and they forced the door open.
Okay.
And they just helped me and I just had to sit down and yeah.
Okay, great. And then they called the ambulance?
Yeah.
Both need urgent scans to determine just how severe their injuries are. Frank requires a CT scan. Meanwhile, Hazel is wheeled off to X-ray.
So Hazel, take a big breath in there, hold your breath. Good job, breathe normally.
It's a frightening time for this elderly couple. As they await the results of their tests, they're more worried about each other's injuries than their own.
I'm just quite keen to get it out and check to see what grade it is now and where to from here.
And that's the big question. Has Tracy's tumour become more aggressive? Last time it was classified grade 2. Grade 3 is much worse.
So, Chris, we're looking at Tracy's MRIs. We know it's a glioma. So this picture over here is a side view of Tracy's head. This is the area of concern, but it's quite well defined up here, but down here there's this haze. And that's very typical of gliomas, that they have these sort of tentacles that spread through the brain. And that sort of indicates that it may now have transformed into something more aggressive. So perhaps like a grade 3.
It's devastating news for Tracy.
So the aim today is to remove the bulk of this tumour, but it will be near impossible to chase all of this stuff that penetrates widely through the brain. Hello, Tracy.
Hello.
How are you?
Very well, I think.
That's good. You're not too anxious?
No, I'm just keen to get it done and see what's going on in there.
Yeah, of course.
Hopefully you'll fix my passwords and all my little memory issues.
Passwords and
I can never
issues.
remember my passwords or PIN numbers.
I'll try, but I have
fix
that
that.
problem as well. Tracy's tumour is in a location that's quite close to the area of brain that controls movement down the left side of her body. So that's one of my biggest concerns, is not to cause a disturbance with that. Obviously, if we cause some paralysis, either of her leg or her arm, that will significantly alter her quality of life.
Yep, touch your nose.
So far, it's not looking good.
That's it, and out to my finger again. That's it, beautiful, put it down. Can you say baby hippopotamus for me?
Baby hippopotamus.
When you get those patients that come through and they've got those classic signs, they've got a speech disturbance, they've got a bit of a weakness, they've got a bit of a facial droop, I'm automatically thinking clinically it looks like that patient's having a stroke.
Can you tell me what happened this morning? Should we go around the scan?
I was about to get ready to go to work, and then I went to the field, and Her right arm just had no more strength in it.
Yep.
Then I tried to call someone, I couldn't speak for the whole hospital, called ambulance.
Okay, time is critical for us, so time is brains. It's about 1.9 million neurons per minute that is killed off after stroke.
Less than 15 minutes after arriving, Bruce is already having a brain scan.
I can make sure that my team is well coordinated and everyone's doing what they need to do to make sure our patient gets exactly what they need and they move through the process really quickly.
What we're going to do is we're going to have a quick look at those scans. We're going to try and get your blood pressure down a bit because it's a bit too high at the moment. So we'll keep giving you a couple of medications and then I'll come back around and talk to you in the emergency department, okay?
There are certain types of treatments that we can offer. IV thrombolysis is one of the clot-busting drugs that we can give. The sooner we give that, the better the outcomes are for our patients.
So I'm going to go around and keep lowering his blood pressure and I'll start it.
No, it's 3.
So, Bruce, so we've finished those scans. There's no bleeding there.
That's kind of a good thing,
That's a
isn't
good thing, yes.
God, that's a good thing.
But you do look like you are having a stroke, and it looks like it's in one of the smaller vessels in your brain.
But until they get Bruce's blood pressure to a safe level, they can't start treating the stroke.
Your blood pressure's still a bit high, so we need to try and quickly get your blood pressure down, and then we'll give you that medication. Because if we give it to you when your blood pressure's too high, the risks of bleeding are higher. So we need to try and reduce his blood pressure to about 180 because the lower his blood pressure is, the less likely he has a bleeding as a result of the clot-busting medication.
Now all Kylie and her team can do is wait. But they know every second increases the risk of brain damage.
Neurosurgery is a very precise surgical specialty. It's particularly difficult in the brain because the brain's very soft and almost a liquid consistency, so you almost don't get any feedback with your hands, and so you've got to use your vision as well through an operating microscope in order to perform the task. So it really does bring your whole brain together when you're performing this task. What I'm doing here is cauterizing or burning some of the blood vessels. In certain locations, there are some very important blood vessels that if we sacrifice them can result in stroke. What I find amazing about the brain and what I love about the brain is that it is who we are. So without the brain, we are not human. We are not a life form. And I guess that sort of pinnacle position that an organ system has in your body is what really drew me to it.
Hi, Hazel. I'm one of the trauma doctors. So you hit a pole.
Yeah.
And I understand that you popped your arms up.
Yeah, I did. With the bag, it just happened so quick.
Yeah, no doubt.
Yeah.
As they lie side by side, worrying about the results of their scans and x-rays, Frank and Hazel are just glad they have each other.
Most wonderful man I've ever met. And he's loving, kind. He's there for me, whatever. I mean, he'll always be there.
Oh, she's the most wonderful person. Absolutely in every possible way. I couldn't think of anyone I'd much rather be with than Hazel. I'm so lucky that she finally chose me.
Theirs is a love story that started later than most.
I was 71 when I actually asked Hazel, and I thought I was such a cradle snatcher. She was only 65. We met in 1983. She was going back up to Sydney. She was leaving Hobart. And I realised as I watched her walk away that I didn't want her to leave. But eventually I wrote to her, told her what I felt. Could we be more than friends? But she sent back, maybe. Oh, I shouldn't laugh.
That's just very natural and easy.
We've never been happier.
Yeah.
ED consultant Catherine Bennett arrives with their results, and it's mixed news.
So I've come to tell you that your CT scan doesn't show any fracture of your sternum or any other injuries. And so from our point of view, that means you can go home.
Unfortunately, the news isn't so good for Hazel.
So you've broken both wrists. One is slightly worse than the other, and in a position that's not optimal. Obviously, with both wrists broken, that's going to make things difficult for you at home. So we just need to make sure that we've got that side of things sorted as well.
Yeah. 2 broken wrists means one thing. Hazel needs to stay in hospital for surgery.
Oh, it's been one hell of a day.
I feel so guilty putting you into this.
Don't ever feel guilty.
Bad.
No, I could have done it. Anyone could have done it. The pedals are probably too close.
Oh, they're a sweet old couple. You begin to imagine how the poor thing's feeling. Brand new car into the garage, and now he's okay and she's got the 2 fractured wrists. Love is grand.
Love you. Oh, don't do that again.
No,
Okay.
I'll see you in the morning, though.
Okay, love, sleep well if you can.
We're not usually apart, so it's hard. And hard for her too. Thank you very much.
Hazel's surgery is scheduled for first thing in the morning when she'll have plates fitted to both wrists. 62-year-old Bruce is having a stroke. His blood pressure has gone through the roof. It needs to drop before he receives clot-busting medication.
Oh, let's go. Let's go. We're down. Okay, good to go.
Thank you.
So now that runs over an hour.
That's an hour, is it?
Yep. Yep, so that'll take an hour to go through, and then we'll just try and keep your blood pressure down for the next 24 hours. We'll keep a close eye on you and see how you go.
Bruce isn't out of the woods yet. At the moment, he's having the thrombolysis, the clot-busting medication. The main risks at the moment are that the thrombolysis won't work and his stroke will get worse. And the other main risk is the thrombolysis will work too well and he'll have a bleeding complication. But we've just got to get the rest of the treatment in over an hour and then watch and wait, observing his neurological function as we go.
But after receiving the stroke medication, Bruce appears to be going backwards.
Can you say baby hippopotamus now?
Maybe
No. Okay.
Maybe hippopotamus.
We're going to take you around and do another scan. Okay. Bruce's symptoms have started to return, so he's having trouble saying baby hippopotamus again, and he's having trouble holding that arm up. So we're just going to do a scan to see if he has had a bleed or if there is another clot or something that's happened, just to see if we can see any changes.
I think it must be terrifying for a patient, so a big part of my job is making sure that they feel like they're safe and being looked after.
So, Bruce, I know it's all a bit of a panic and we're worried about you bleeding in the brain. I think what's happened, watch that line. Yeah. I think what's happened is we've dropped your blood pressure too low and your brain doesn't want it that low, and that's why these symptoms are coming back.
Bruce, how are you?
Yeah.
Can you say baby
hippopotamus?
And again, baby
hippopotamus.
Beautiful.
Baby hippopotamus.
Arms up for me. Turn them up like you're holding the tray. Good. Close your eyes. Fabulous. And pop them down. And can you do this finger at the moment? Yep, onto your nose. Back up to my finger. Nose, finger, nose, finger. Excellent. You're just trying to give us all a heart attack. You're looking really good. There's no bleeding in the scan.
Yeah.
It's probably that your blood pressure dropped a little bit too much, so we're just going to have a little bit of a balancing act over the next little while to keep that right.
So that GTN is down to 6 from 31.
When his wife Frances arrives, Bruce is keen to talk things down.
There you are.
Yes.
You've given us a scare.
You didn't have to come. I told you, darling, not to come anyway. You could have stayed at work. There's no big deal. That's
Miss all
okay.
this?
It's a small stroke. That's small. I can even talk better now. As my blood pressure goes up, I talk better. When it goes down to what yours like, I can't talk.
Except he keeps trying to talk even though he can't talk properly.
Yes, I can't. Yes. I can talk better right now, actually. Best I've been. What's that thingy I say?
The blood pressure?
Yeah.
Oh, baby hippopotamus.
Baby hippopotamus. Yeah, I can say a lot
Look
better
at
than I
that.
could before.
Oh, is that your test word?
It is.
That is.
Baby.
One of them. Yeah, baby hippopotamus.
He couldn't really say it at all the
And
first
that's my
time.
hand. It's got the thing on it and it's weak as hell. I can't even, that's the one that went off. I couldn't, the banana you gave me? I couldn't peel. I tried to peel. I couldn't peel the bloody thing. I peeled one side of it and it started to get worse and weaker. And I thought, this is shit. What a shit banana. Then I thought it was me. And then I couldn't talk, so I called the ambulance to come and got me.
Well, you've saved your own life, haven't you?
last time I
Because
called him,
you
she
knew
yelled at me.
you knew the symptoms to call the ambulance.
last time
I
he
try
yelled
and
at me
give him
before,
a
I
banana
shut up.
every day
Oh,
because
do you?
it's good for all the fruit and vegetables that's in a banana.
Well,
But
it
he
worked
doesn't
wonders
like
today.
Yeah.
Bananas saved your life. I'm going to call you B1.
Yeah, okay.
Professionally, it's hugely rewarding to be able to see these changes, and it's such an exciting thing to be a part of.
So now that the main part of the operation is over and the tumour's out, we are now going to close and put everything back together again. So here's the bone, and we're going to put this back. We use these little plates and screws to hold it in place. We've got 2 of these, and she's got 1 in there from her previous surgery, which we will attach back, and that should hold it in place quite securely. Okay. So Chris is putting in the final suture, and then we'll be able to wake up Tracy.
And only then will Dr. Shivalingam know if Tracy has any issues with movement or paralysis.
And we test her function, her movement in particular, to make sure she's fine. It is very rewarding being a neurosurgeon or a doctor even who's got a solution for someone, a path forward. And sometimes it's not a perfect path forward, but it is something. It's better than having nothing. And that is probably the most joyful part of being a doctor, and in particular a neurosurgeon.
All finished.
As she slowly comes to,
Hello, Jen. Speaking. Oh, hi, Jen. It's Brenda Shivalingam here.
Dr. Shivalingam calls Tracy's mum to let her know how the surgery went.
Good, good. I'm just calling to say that everything went really well, and Tracy's now in recovery.
But there's only one thing Tracy's mum wants to know.
Can I ask, did you get it all?
So I've taken out the bit that I could do safely, and that's the bit that's changed recently, so it's the most important part of the tumour to remove.
Okay, thank you.
Okay, see you soon.
Bye.
Bye. Bye.
After Tracy's 3-hour operation, her comprehension and movement are being assessed to ensure no damage has been done.
Can you tell me where you are?
RPA.
Very good. And why are you here?
Craniotomy.
Okay, very good. And can you raise up your left arm for me? Excellent. And your left leg? Good. Okay. Everything went very smoothly. Okay? No issues.
She might be groggy, but it's very clear what she wants to know.
Do you recognise me? I know it's a bit hard with everything on.
Does it look like low grade or?
To my eyes, it looked like it was possibly a higher grade than a grade 2. But we should just wait for the results. The good thing is, so I got out the area that we wanted to get out. Remember those tentacles, though? They're still there. And they're the ones that we can't chase because it would involve removing almost a quarter of your brain. So, yes, I did remove the bulk, the top bit, the bulk, which is the tumour that had recurred and was causing some change. Okay? You should rest up. You should rest up. Sit back, relax, and...
I've been asleep all morning.
Have a bit of a rest. Okay?
Imagine seeing you here.
Yeah, I love it. How'd you go? Yeah.
Frank was driving when his foot slipped on the accelerator and their car slammed into a concrete pillar.
It was a terrifying surge, though, wasn't it?
I know.
Hazel took the brunt of the accident when the airbags went off,
Oh, dear.
breaking both her wrists.
And what about the car and everything?
It's a write-off.
A write-off, yeah. Total write-off.
Totaled, yeah.
Now, just hours before surgery, it's really taking its toll.
I say so.
I'm crying.
I know, it's just... I'm just worn out now.
Yeah.
It's just hard. Physically hard.
With 2 wrists to repair, 2 surgeons will operate.
So Hazel managed to break both of her wrists in a very similar way. And in her age group, there's evidence that if she had just one broken, you can manage non-operatively. But having both out of action is a bit tricky to maintain independence, especially at her age. So getting her going as soon as possible is the aim of this operation, where we're going to fix both, and we're going to try to get her back to her normal function as soon as possible. Right, let's do this.
Each surgeon takes an arm. By fitting 2 plates into Hazel's wrists, there's no need for any plaster casts, which would massively impact her independence.
So I can see the fracture. I think I've got it in pretty much the right place. So I'm just going to pop this plate on. It's a little blue piece of titanium that is bent to conform to the end of the radius bone. So I'm hoping that when we get the X-ray, it'll be pretty much in the right place.
An X-ray helps them make some last-minute adjustments.
So I need to move that back a little bit, yeah? You can see where my wire is. I just want to be 2 or 3 mils behind before that.
It's a matter of millimetres that can mean the difference between causing irritation of those tendons that pass over this plate.
That's what we want. Let's have the drill, please.
Captain, come down. Very good. Hazel, this is just an oxygen mask on your chin. Take some big breaths, OK? Just waking up from your operation.
I'm happy with that. We're leaving her out of plaster. It's a really big sort of quality of life improvement for this lady, that she can actually, you know, maintain her dignity and privacy.
Without the need for any casts, the hope is Hazel will make a very quick recovery. The day after Tracy's surgery to remove an aggressive brain tumour, she can't wait to go home.
Hello, Tracy.
How are you?
Good. How are you?
Good.
You look very well.
Yeah,
You look like you're ready to go home.
I am.
How does she look?
Very good.
Are you relieved?
Yeah.
So you're feeling okay?
Awesome.
No issues?
No, I can see peripheral. Yeah.
Excellent. Okay, well, as I explained yesterday, everything went according to plan. I was really happy with how the operation went. Now it's just a matter of waiting for the pathology results to come back.
When the results come, obviously it's still going to be an oligodendroglioma.
Yes.
It's just
The
potentially a
question
higher
of whether
grade.
it's a 2 or a 3, correct.
I feel so much better.
Good. I'm glad.
Yeah.
Very glad.
And nothing even really weird.
Yeah. And, well, you know, your hair's there. There's nothing, like, you can't see anything.
No.
It's invisible.
I know. I actually had a thought when I was eating my cheese sandwich down in recovery.
Yeah.
I thought, oh, no, I bet it's one of those cases where you've opened it up and had a look and thought, damn it.
Oh, no.
And then just stitched me back up and sent me on my way.
Not at all. Not at all.
That's what I thought. I thought, I bet she's done nothing.
Oh, goodness.
Because I was like, because last time I couldn't do that.
Right.
And wiggling my toes.
Really?
Yeah. I'd try and wipe my nose and I'd poke my eye.
Oh,
and,
wow. Okay.
You know, just silly things.
Yeah.
So I was doing all these things and like,
yeah.
she's just had a look and thought, Christ, it's too hard.
Nope, nope. It all went just fine. Okay, Trez.
It's good.
Take care. All right.
It's very good.
Goodbye.
Thank you.
See ya.
See you.
Thank you.
Let's go home. I feel really good and actually more positive because when it comes back, I'm just coming back to here. We'll just keep taking those pop rivets out and get rid of it. I feel a bit more like I'm going to be around a bit longer. Really good.
With titanium plates in each of her shattered wrists, Hazel is looking a lot happier than she did yesterday.
Hi, good morning.
Hi. Yeah.
My name's Ellie. I'm one of the doctors here. I work with Dr. Franks.
Yeah.
How are you going?
Good. Getting a bit sore today.
Bit sore, yeah.
Yeah, but good.
Yeah, I was in the operation yesterday and it all went well and Dr. Franks is really happy with how things
Oh,
have
I'm
gone.
glad, yeah. Well, it felt really good last night, but it's wearing off a bit now. Yeah.
We'll make sure we've got some pain relief on board.
It's been a hard time for Frank too. This normally inseparable duo have been forced apart for 2 nights.
I didn't know how you were, whether you'd be, you know, have a reaction when you got home.
I did. I was very lonely.
Yeah, I know, I know. We spend all our time together, so we do miss each other, don't we?
Yeah.
Mm.
Be nice to have you home.
It'd be nice to be there.
Yeah. And nice to be able to hold her hand again. Haven't been able to do that for the last couple of days.
Mm.
So I'll get your bag ready and we're off.
Oh, I can't wait. Oh. I want to go home. I want to go home. Thank you. Take a seat.
Tracy is recovering from surgery to remove a brain tumour. With the operation behind her, she is now about to learn if it's become more aggressive.
It is an oligodendroglioma, and that was always what it was. But as anticipated, it is now a grade 3. We do have to think about other treatment, and that will take the form of radiotherapy and some chemotherapy. Preparing someone for the worst, yeah, that's it. It's I don't know how to answer how to prepare for it, because I don't think no one's really prepared. But as a neurosurgeon, I certainly feel a great sense of purpose to be there for people when they are going through this stuff, to be able to hold their hand, to give them something, to do something to make it better.
Now, once the treatment starts, do you know how long the radiation goes for and then how long the...
Yeah, so generally it's about 6 weeks of radiation and then up to 12 months of chemotherapy. Okay.
All right, that's something to think about.
Yeah.
Okay.
Even though it is a grade 3, and I know it always sounds, it's way more worrying for individuals when it's a grade 3 tumor. However, oligodendrogliomas behave better, they're easier to control, and therefore I would think that you have a very good long-term prognosis. Okay.
Okay. Thank you.
Okay, Tracy, it's so good to see you. One of the things about brain cancer is that we know from the very beginning that this patient has brain cancer. And so this conversation has happened many times, and over those many times you help people adjust to what is to come. But it's an incredibly rough time and a journey and a pathway. But my experience is that most people really appreciate that I'm there with them through that they can talk to me about it.
I guess I'm happy that she feels she got all of what was in the old surgical cavity. Obviously, having some of those tentacles there is a concern. When Brenda said she thought it looked like it was higher grade after doing the surgery, I was fairly nervous about coming here today and finding out more about it. But anyway, just got to be positive and, yeah.